Welcome to Harness the Power of an HSA. My name is Katrina. Let's dive right in. Combining a health equity health savings account, or HSA, with an HSA qualified health plan delivers incredible benefits. HSAs are the only triple tax advantage accounts available. This is why we like to call them the unicorn of healthcare accounts. HSAs allow you to contribute pre-tax funds, grow tax-free earnings, and enjoy tax-free withdrawals to cover qualified medical expenses. If you choose an HSA qualified health plan, also known as a high deductible or consumer choice health plan, you can use your tax-free funds to purchase all of the items pictured here: contact lenses, over-the-counter medicines, even Band-Aids, and much, much more. Let's face it, health insurance terminology can be confusing, even for the smartest people. Let's make sure we all understand a few health insurance terms that will be important for our discussion today. Premiums are what you pay, usually per pay period, to have health insurance. It doesn't matter if you don't use your insurance at all or if you use it a lot, you pay the full premium throughout the plan year. Your deductible is the amount of money you have to pay for your healthcare before your health insurance plan will start to pay for medical services. In other words, your health insurance kicks in only after you've paid the amount of your deductible out of your own pocket. Generally, plans with lower premiums have higher deductibles, and plans with high premiums have lower deductibles. HSA qualified plans generally have lower premiums and higher deductibles. The next part of insurance is generally coinsurance. Coinsurance is the percentage of medical care costs you pay after you've paid your deductible, but before the out-of-pocket maximum. Your out-of-pocket maximum is the maximum amount you will pay out of your own pocket for covered medical expenses in a plan year. After you spend this amount on deductibles and coinsurance for in-network care and services, your health plan pays 100% of the costs of covered benefits. Lastly, let's define preventive care. Preventive care includes screenings, checkups, and counseling to prevent illnesses, disease, or other health concerns. HSA qualified plans cover 100% of your preventive care, which means you can confidently get ahead of your health with annual physicals and not worry about paying anything out of pocket. This preventive care is throughout the entire cycle of the year, whether you're in your deductible phase or you've hit your out-of-pocket maximum. Again, your HSA qualified plan covers 100% of your preventive care. Like I mentioned, HSA qualified plans have lower premiums than traditional plans. This enables you to unlock immediate savings as you put the money you've saved on premiums into your HSA instead. Because this is done pre-tax, you have more money to pay for qualified medical expenses. Let's get into some of these tax savings here. Hypothetically, let's say you save 30% in taxes between your payroll taxes and federal and state income taxes by contributing to your HSA. That means for every $1,000 you contribute, you save about $300. That's an extra $300 you can use on things such as health insurance deductibles and coinsurance. You could utilize it on medical treatment, including non-traditional treatments like massage, chiropractic treatments, and even acupuncture. I do want to note that massage therapy does need to be recommended by a physician, and you will need a letter of medical necessity in order to purchase that from your health savings account. You can also utilize these funds on your prescription medication. Also, everyday items such as cold medicine, allergy medicine, and other over-the-counter medications. You can even utilize these funds for vision and dental expenses that may not be covered by your health plan. That's right. Instead of paying federal, state, and payroll taxes, the money is yours to use on your medical needs or even just to save for the future. If you're maxing out your 401k and individual retirement account contributions and you're looking for another place to invest your future, your HSA is a great place to start. One of the things that I love most about HSAs is that you can invest your HSA funds so they grow over the long term. Just think of an HSA as a health IRA. And when you turn 65, that HSA will act like a traditional IRA, allowing penalty-free distributions for any reason. Withdrawals made for purposes other than qualified medical expenses will just be subject to ordinary income taxes. Let's take a moment to review. Based on what I've said so far, which taxes will you be required to pay on the money you contribute to your HSA? Could it be state or federal income tax, payroll tax, or none of the above? If you chose none of the above, you're correct. Because your HSA contributions are made pre-tax, they grow tax-free and can be withdrawn tax-free when used on qualified medical expenses. Potentially, you could save thousands of tax dollars each year. Even if you don't have an immediate expense in mind, it's still smart to be prepared. In fact, over half of Americans every year are surprised by unexpected medical expenses. In a recent study done by Visa, one HSA member said, "Having an HSA account makes me feel safe. It makes me feel secure. It makes me feel good knowing we have the funds set aside for any little emergencies that arise." Now that you understand why you should contribute, let's talk about how much you can add to these incredible accounts. This is based off of the coverage level that you have through your insurance plan. So if you are on single coverage, that allows you to contribute up to $3,600, which gives you an estimated $1,080 in savings. If you are on family coverage, you plus one or more dependents, you can contribute up to $7,200, which gives you an estimated $2,160 in tax savings. And if you have reached the age of 55 or older, you can contribute an additional $1,000, which gives you an extra savings of $300. Some companies even contribute to their employees' HSA accounts. It's worth asking to see if your company is one of them. Please keep in mind, if they do add any contributions to your health savings account for you, it does count towards the annual contribution limit for the year. Unlike some other accounts, you have the flexibility to change your HSA contributions throughout the year based on your needs. This means you can contribute more in the beginning of the year to cover a larger expense, or spread out the contributions evenly over pay periods. You could even stop contributing altogether and pick back up when you feel comfortable to do so. You also never lose your HSA dollars. This is so important to know. Money in your account rolls over year after year, even if you change health plans or employers. And people change jobs an average of 12 times throughout their careers. So it's important to know this account is with you even as you move on. Let's look at two examples of how an HSA could be used in the next year to help people save on healthcare costs. Note that these are used for illustrative purposes only. Health plans vary, and we encourage you to learn more about your HSA qualified plan to see how it benefits you. Now, let's meet Camilla. In her late 20s, Camilla is healthy and rarely goes to the doctor except for yearly physicals and vaccines. When comparing options, she realizes these visits are 100% covered with the HSA qualified health plan, and she can save $50 each pay period on premiums compared to the traditional plan. Instead of paying higher monthly premiums she won't likely benefit from, she decides instead to build a health savings by contributing the $100 monthly premium difference directly into her health savings account. One late summer evening, while enjoying a little bike ride through town, she's involved in an accident. Not knowing the extent of her injury, she calls a friend to pick her up and bring her to urgent care. Camilla immediately gets knots in her stomach, thinking about the bill from the visit. Her friend, noticing this, reminds her that she can use the savings that she's built in her HSA to pay for the visit. Just to make sure, Camilla calls Health Equity, even though she thinks it's unlikely that someone will answer at such a late hour. Within seconds, someone is on the other end of the line, assuring her that she can use the funds in her HSA to pay for the visit. In addition, she learns she can use her HSA to pay for both chiropractic visits and over-the-counter and prescription medications that resulted from the injury. In November, Camilla is still recovering from her accident when she is offered a new position working remotely from home for a company she's always wanted to work for. Her HSA account stays with her as she transitions to this new job, allowing her to continue her medical treatment without interruption. At the end of the year, Camilla realizes she spent about $1,000 recovering from her accident. By paying with her pre-tax HSA funds, Camilla saved $300 that went toward her qualified treatment. Now fully recovered, she hops back on her bike with confidence, knowing she made the right decision by choosing an HSA. Next, let's meet Mia and Evan Jensen. They are expecting their second child in July, and their HSA qualified plan year begins on January 1st, 2021. Their HSA qualified plan has a $5,000 deductible and includes 10% coinsurance until their out-of-pocket maximum of $7,000 is met. They decide to contribute the family max of $7,200 into their HSA to cover the medical expenses associated with the birth of their child. They start their HSA contributions at $425 per paycheck, so by July 1st, they will have deposited over $5,000 in their HSA. That way, when they receive the bills from the birth, they will have funds in their HSA to cover the whole deductible. In July, their beautiful child Benjamin is born, and they are delighted. As planned, they reach their $5,000 deductible, which they paid with tax-free HSA funds. At this point, they log into the Health Equity portal and adjust their HSA contributions to once again reach the maximum limit and cover the $2,000 of coinsurance. To their surprise, they still have a couple $100 left in their HSA at the end of the year, which they roll over to use for future medical needs. With 2 young children in the house, there's no limit to the useful ways an HSA can help them save. Now that we've put the HSA into action, how do you know if you're eligible to contribute to it? First, make sure you're covered only by an HSA qualified plan and that you do not have other health coverage, including your spouse's non-HSA plan, Medicare, TRICARE, or another traditional health plan. You'll also want to verify you don't have access to any full-purpose flexible spending account funds, even through your spouse. Next, make sure you're not claimed as a dependent on anyone's tax returns. And that's it. The question you're facing right now shouldn't be whether to enroll in an HSA, it's how much to save. Will you just save the amount your lower premiums offer you? Or will you shoot for the yearly maximum and take advantage of the HSA triple tax savings? Whatever you choose to contribute, we make it easy to use your HSA funds with HSA debit cards. Use your login and manage everything with our simple mobile app. Want to submit a claim? Just snap a photo and you're on your way. And you can call us day or night. Our member services team is available 24/7, 365 days a year to take your calls and respond to any questions that you have about your health savings account. Thank you for taking time to learn how to use the HSA to save on healthcare premiums and build long-term savings. Please remember we are here to answer any questions you may have.